I'm Paula Nutting, your musculoskeletal specialist. Today I thought we'd look at more options to treat people who are complaining of neck pain and ways to actually help with them doing active movement with your treatment. A little bit of anatomy and bony landmarks. We're going to be looking at the areas of the neck, lateral and posterior lateral. So just in this area here, if we think about Bruce and his bony landmarks, the mastoid processes here and the sternocleidomastoid attaches to that and comes down and attaches at the sternum and the clavicle. So sternum and clavicle, hence sternocleidomastoid. We've also got the scalenes that are deeper in here, and especially the posterior. Now they will attach all the way down the side of the neck and come into the first rib and the second rib for the posterior scalene. So some of your clients and patients might complain of common referral pain that is suggestive that they've got some scalene involvement, and even though they're lateral flexors, we can do cross fiber friction using rotation, so active movement with our patients, to release and lengthen and help support those muscles to feel better quality, not so ropey and bandy, and less pain. We're going to address those so that they don't feel as tight, as ropey and bandy, and you'll have more movement in side bending as well as rotation. So I'm going to get Krista to sit square on so I can palpate these muscles, and I'm feeling for quality and tension. So I've got quite a bit more tension on the right than I have on the left. So the right's the area that we're going to be working on. So I'm going to ask you just if you're going to move your nose to say what would be 10 o'clock, and then you're going to move your nose to what would be 2 o'clock. So that's the action. Whilst we're doing that, to make it easier for the camera, just swivel your knees a little bit more that way, and you can see my hands, and I'm going to, as she's looking this way, I'm going to have my hands at the back, so posterior to that taut band, and then as she turns towards my fingers, I'm actually gliding my fingers anteriorly, so I'm going towards you, and then she's going to turn away and I'm gliding back. As she goes to the right, I'm gliding forward, and there we could just feel that first band, didn't we? Okay, back and forward, and what I'm doing is I'm just ever so slowly moving my fingers towards those ribs. We start quite cephalic and go caudal. And now I'm catching bands of the trapezius as I go down even further. Great job. Okay. And now palpating again. Can you feel the difference between those two? Yeah. I don't often do a pre-test of rotation because we're not addressing rotation, but I might do a pre-test of lateral flexion, and we'll have a look and see the quality of the movement versus the other side. And definitely she's actually has got more restrictions on this side, which would indicate I'm going to do more work at the attachment points for the scalenes, as well as some of the other muscles that attach through here. So splenius capitis, splenius cervicis, levator scap, and all in a big global picture where she's going to do movement. I'm Paula Nutting, your musculoskeletal specialist.